Why is Lyme disease not well understood by a lot of doctors? And the answer is actually quite simple. It's a lot more complicated than doctors would see on the surface unless they work in the field. You think of Lyme disease and you go, okay, well, the patient's going to have a bullseye rash and they're going to come into your office with a tick in their hand and say, oh, my patient has Lyme disease. It doesn't really work like that. A lot of patients never even have tick bites. They never get bullseye rashes where they get on the tick bites where it's evident. I think it's like 50% that don't even have that. And a lot of the laboratory tests, in fairness to physicians, aren't very good. They're using, ELISA, and they're doing basic screening, then maybe Western blot. And then, if you're fortunate enough to find a doctor who's Lyme literate and using specialty labs like Igenics and others that use microscopes and look at these and stain for the Borrelia, you might get one infection, Lyme disease. Say, oh, okay, it's probable you have this or you have this infection. But then they're missing all the co-infections. And then they're missing what the status of your immune system is. And then they're missing other toxicities that are involved. So Lyme disease is very complex. And the best way for me to explain this is there's 360 plus mimicking diseases. So a lot of people may have this Lyme disease or other tick-borne infections and other co-infections. And we've published on this as well. And in one of our papers, we talk about how many various symptoms people can have and how many co-infections can be involved. The key is, do you have a doctor who can test for all those using specialty laboratories and then build a custom treatment plan to go after Lyme disease? So the reason why it's difficult is because physicians think of Lyme disease as one of many diseases. In fact, I would say you have to change your way of thinking. If somebody's presenting with neurological chronic diseases, autoimmune-looking chronic diseases, fibromyalgia-like, MS-like, lupus-like, ALS-like, Parkinsonian-like, I can go on and on, you better look for tick-borne infections because you'll be surprised how many times you find that in the patient. And then you have to look for a patient who's immune compromised and has lots of primary and secondary co-infections. So it's not untypical for us to see a patient who has 8, 9, 10 different infections going on all at one time, all of them untreated, and the patient is progressing to get worse and the symptoms are getting worse. So, in all fairness, unless doctors are trained in this area and they've been working with these types of patients like we have for the last 17 years, it is very difficult. This isn't something you're going to learn real quickly by reading something in a journal or going to a weekend conference. This really takes a lot of focus and time. And just to add to that, when we bring in doctors that become part of our team or get trained by our group, it takes a long time for them to really get their hands on this. It can be working in the field for a good year and a half before they really are able to start to digest Lyme disease and its complexities and all of the different symptoms that it can present in a patient. So thank you for that great question. And if you want to learn more about Lyme disease, how we approach it, I have other videos that I've created that actually you can contact us and it walks you step by step our approach to treating Lyme disease, which will help even further explain why it's so complicated to diagnose. Thank you for joining me, and may God bless you on your journey to healing.